Hello, I'm 5th District Supervisor Joe Baca Jr. As the issue of fentanyl grows in our communities, we're uniting as a county to tackle this issue together. Today, we have the privilege of being joined by a distinguished panel of experts and community leaders who are at the forefront of combating the fentanyl crisis. Together, we'll explore the complexities of fentanyl misuse, discuss strategies for education and prevention, and lay the groundwork for collective action. Let's join forces to safeguard our community and create a better future for all. Thank you for tuning in. Okay, well, thank you, everybody. I'm honored to introduce our special panelists that are here today, and it's really an honor to be here, but want to thank them for being here. Our first panelist is addiction medicine physician, Dr. Jonathan Avalos from the Department of Behavioral Health. Welcome. Thank you. Also, we have San Bernardino County Under Sheriff Horace Boatwright. We appreciate you being here. And we also have the San Bernardino County District Attorney, Jason Anderson. Welcome.
Thank you.
And last but not least, we have Secretary Treasurer of Victims of Illicit Drugs and Jessica's dad, Mr. Steve Filson. And thank you for being here today.
Thanks for having me.
And each one of these panelists brings insights and experience of handling different aspects of the fentanyl crisis. So we want to thank them all for being here, and we're going to go ahead and go straight into the questions. We'll go ahead and start with our first panelist, Dr. Avalos. Would you please start explaining why fentanyl has become a prevalent drug in our communities today?
This comes down to two factors: potency and production. In terms of potency, we have to understand that fentanyl is quite different than other opioid drugs. It's estimated that fentanyl is approximately 50 times stronger than heroin and approximately 100 times stronger than morphine. As a person continues to use a substance, such as an opioid, the need for higher and higher doses is universal. It's called tolerance. So it stands to reason that the demand for ever-increasing potency in opioids exists in the market. The second point that I have is production. Fentanyl is a synthetic opioid, first developed in the 50s. Unfortunately, it is very simple to produce. It requires only 2 steps to produce fentanyl, as opposed to heroin, which is actually a plant product, requiring a much more complex production process and purification process. So what this means is that heroin is much, much stronger than other opioids, and it's much easier to produce.
Now, you bring up 2 good points, and I'm sure that people that want to get a quick high, you look at the potency where people can get high quickly. The other thing you mentioned is very, very easy to produce, so I'm sure the distribution becomes very, very easy, which will become a challenge to our law enforcement, which has to deal with this distribution. We appreciate that response, and it's a great response. Thank you so much.
Thank you.
Okay, next we have the Under Sheriff, Sheriff Boatwright. From a law enforcement perspective, how does the prevalence of fentanyl affect our communities?
Thanks for the question, Supervisor. According to the California Department of Public Health, in 2021, there were 6,843 opioid-related overdose deaths in California. 5,772 were related to fentanyl. Recently, our department decided to do a survey or a poll with the community to find out what do they know about fentanyl, what we need to do in terms of, to educate them about fentanyl. And I would like to share some of the results from that. The first question that we asked them was, how much, if anything, have you heard about an opioid called fentanyl? 93% said they heard a lot or a little about it. The second question we asked was, how serious of a problem is fentanyl in the United States? 92% said it's very serious or somewhat serious. And the last question that we asked, reference fentanyl, was, should the government be doing more or less to address the illegal distribution of fentanyl in the United States? And 88% said they should do much more or somewhat more. So through this process, this shows that the community is being educated. However, they want something done about this particular drug.
No, we appreciate you sharing that data. So clearly it's a problem in our community. The numbers continue to grow over time, but the fact that it sounds like the community is screaming for more, for more help from our government, from our law enforcement, from our district attorney, anything we could do to prevent this spread of fentanyl. So thank you so much for your comments.
Certainly.
The next question we have is for San Bernardino County District Attorney Jason Anderson. So can you tell us how the legal system is addressing fentanyl dealers and what accountability measures are in place?
We have a number of cases that we're prosecuting people for dealing fentanyl, whether they're transporting it or they possess it for sales or they're selling it to individuals. We have several prosecutions that we have ongoing where people have died as a result of getting fentanyl from a dealer. One of those cases just ended in an involuntary manslaughter conviction. We are approaching it from the rule of law, which dealing drugs is still illegal and we will prosecute it. There may not be as much teeth in the law in terms of punishment as there used to be. We're particularly sensitive if there's fentanyl in guns because then we can actually get some stiffer penalties. But the ones in which people are dealing and knowingly dealing essentially a poison to people that results in their death, we're looking at those very, very difficult, as we have with that one prosecution, and we are working with a couple of other agencies that we're talking to them about cases in which there have been overdose deaths where it may be the dealer knew what they were dealing, it was a bad batch or the person was going to overdose.
Yeah, and we appreciate the district attorney's commitment to trying to address this issue. And we know it's been difficult because of the laws, but you're doing everything you can in your power to do that. And we want to say thank you for doing that.
Yeah,
we
you got
appreciate
it.
that.
You got it.
Our next question is to Mr. Filson. One of the things, Filson, that you're very passionate about is what can we do to educate the community about the use of fentanyl? What can we do as a government, community, to try to share this message with our community?
Well, we have to understand that illicit fentanyl is being introduced in a variety of ways, not only through fake pills, but is now being added to common street drugs and recreational drugs such as methamphetamine, cocaine, heroin. And people that are using these drugs, one of which was my daughter Jessica, had decided to use cocaine one night with her boyfriend and got a product that had been fentanyl added to. That was her last experimentation, her last use of that drug. She never woke up. The people have to be aware of that potential and that potential deadly risk that comes with the use of any type of recreational drug. We have to reboot society. We have to reboot society's thinking when it comes to experimentation. Back in our day, I'm a kid of the 60s and 70s. Okay, the old Haight-Ashbury, San Francisco experiment with whatever, and it was peace, love, dope, or whatever you wanted to talk about. We can't do that anymore. Fentanyl changed that narrative. And again, we have to reboot society's thinking into doing that. Addiction needs to be dealt with, but honestly, addiction has little to do with illicit fentanyl and has a lot to do with those first-time users who are made either for self-medication purposes or just trying to get a different high. But that experimentation, again, leads to their death. And we, again, need to change that narrative in order to begin reducing the number of deaths that are occurring nationwide. 1 every 5 minutes. It's tragic. This is not a joke. It is not exaggerated by any means. It exists. My daughter is an example. And again, 1 person every 5 minutes is a further example of what fentanyl's potency and fatal potential is.
Well, we appreciate your response, Mr. Filson, and we're sorry for your loss. And just kind of like what Dr. Avalos said, you talked about lacing, where these drugs are mixed together, which increases the potency. And we don't know how everybody's going to respond because everybody's individual, their bodies react differently to this, and that's very tragic. The other thing you mentioned was that, we don't know, sometimes it could be dressed up as candy, and people don't know this, and kids don't know this. So sometimes kids innocently, or they could be at a party or a place that's, unknown to them, and it's given to them, and we don't know how they're going to react. But thank you for sharing your passion with us. That really means a lot to us. Next, we'll go to our panelists. Dr. Avalos, what differentiates fentanyl from other opioids in terms of risk? Tell us about the risk of this drug.
This is a great question, Supervisor. So just to be clear, there is risk inherent in the use of any illicit opioid. But what is so different about fentanyl is the potency. As little as 2 milligrams of this drug can result in a fatal overdose. And that's an incredibly difficult amount to measure accurately. And what is so unfortunate is that when that is miscalculated, when there is a dosing error, the results are fatal frequently.
Could you give the viewers maybe just an idea of what 2 milligrams would look like, the size of a pill, just so they know? And
2 milligrams would be about the size of Lincoln's nose on a penny, and in its pure state. So that is an incredibly small amount. In a clinical setting, it's typically dosed in increments of micrograms, which is very, very hard to measure. And you can imagine in an illicit production facility, the level of precision necessary to safely dose that drug is just not there.
Yeah, that's amazing. You talk about a penny and just the nose on the penny. Just that little amount could have a huge effect on people's bodies. So we appreciate you sharing that with us. Dr. Alice, we also have another question. Could you explain the distribution channels of fentanyl and the challenges in controlling the spread? So it gets spread real easily.
That's right.
How can we control that? What are the channels it's going through? Share that with us.
Well, Supervisor, I can tell you what I've read, and I could tell you a little bit about what I hear in the clinics and treatment facilities. But I would actually invite Under Sheriff Boatwright if he could comment from his experience in enforcement on that.
Sure, I would love to. The drug traffickers, what they're using the same method of distribution when they bring in cocaine or heroin. The street dealers, what they're doing, they're targeting users on the social media platforms like Snapchat, Instagram, and many of those that are out there. And the challenge that we have is the privacy issue. We can't sit there and monitor those different social media platforms because of that. But what we've seen is that a lot of the victims that come in contact with this drug is through those platforms.
Wow, that's amazing. You would think through social media how people can kind of mask this and hide this to try to promote this drug. That's very unfortunate. But I think it's something that's important that our parents and our community should be aware of, to check their children's social media, understand these platforms, and get educated about them. We appreciate you sharing that with us. Next, we'll go back to Dr. Avalos. You want to tell us the stigma plays a role in how society responds to drug use. Can you elaborate particularly on concerning fentanyl use and the stigma with it?
Absolutely, Supervisor. So understanding stigma comes down to understanding the way that the brain works. So I've brought a model to share with you today. As Mr. Filson was saying, when youth are experimenting, for men this would be under the age of 27, for women this is around under the age of 25. This part of the brain, what we call the prefrontal cortex, is not yet fully developed. And this is the part of the brain that tells us, eat your broccoli, do your homework, go to work early, right? Do the things that need to be done, but maybe are not immediately rewarding, right? And so it's developmentally normal for some of our decision-making to be different than it would be in the adult state because of the development of this part of the brain. The other part of the brain that's important to talk about is the reward mechanism, what we call the VTA. And the VTA responds extremely profoundly to fentanyl and drugs like fentanyl. What this means is that the brain then downregulates the pleasure response to normal activities like food, like time with your family, like a beautiful day at the beach, right? And with continued use, a person experiences profound anxiety and depression in the absence of use. In addition to that, if they stop using, they experience profound physical symptoms, which include severe diarrhea, profound pain, and dysphoria. Bearing all of that in mind, I've been extremely humbled by my contact with my patients in our clinics in a treatment setting to understand that fentanyl and addiction can affect all of us, including me. Because of this, DBH has produced a fentanyl awareness initiative. Phase 1 of this includes billboards and radio ads that aim to point out the fact that fentanyl can affect anyone. Fentanyl doesn't care if you're a successful public figure, a physician, a public safety officer, an attorney, a high school athlete, or a mom.
No, we appreciate you sharing that with us, and you bring up a good point. We assume that when kids hit 18, they're mature, but you don't realize that their brain is still maturing, their decision-making is still growing. So it's important for our public to understand that even though they're young adults, we still have to be mindful and monitor them. And you as a doctor dealing with patients coming in firsthand and having to see the tragedies and the things they go through. And I think that's important, that the fact that the Department of Behavioral Health is now educating the community through billboards and their messaging. These are good things we have to continue to do. So we appreciate your comments on that, and it really means a lot.
Thank you.
And the last question I have for you, Dr. Avalos, What are the harm reduction strategies and the role of Narcan in fentanyl overdoses? Many people have these misconceptions of Narcan. It can't be used. You can only use it in certain situations. Maybe you could enlighten the public on that.
Absolutely. So DBH has led the county's efforts in the education and distribution of Narcan. I actually brought this for you as well.
Okay.
So you can...
I hope I don't need it.
Yeah, right. But if you ever do, sir, it's there for you.
But I appreciate it. Thank you.
Narcan is the reversal agent that's used to address somebody who's overdosing on an opioid such as fentanyl or other drug. One of the other things that we're doing is we're sharing fentanyl test strips. And this is a fentanyl test strip. So the way that this works is somebody would test their drug product and they can make an informed decision, even if they're not ready to accept treatment. They're maybe not quite ready to stop using for a number of reasons. They can continue to use in the safest way possible. And the last part is drug disposal. So opioids, such as fentanyl or other drugs, may be a part of medical treatment. And if you're like me, you may be in a multi-generational household where you may have young adolescents in the same household as an elderly person with a number of medications, right? Safely disposing of unneeded or expired medications is incredibly important. So the county and Department of Behavioral Health has begun distributing drug disposal pouches. So the way this works is an unneeded drug product or medication can be placed in a pouch like this, a little bit of water added, and then this can safely be thrown away in just the municipal waste.
We appreciate that, Dr. Avalos. You think of the things you brought up, the Narcan, which can be used by anyone, right?
That's right.
And then you talked about the disposal of drugs, which is important because sometimes people assume drugs are okay. You have young ones, loved ones in the house, may get access to those and dispose them of those are very, very important. And even the drug strip testing where people can test and see if there's fentanyl in there. These are great things that I think our community needs to be aware of, and we appreciate your expertise on these issues, and thank you so much.
Thank you, Supervisor.